It is a difficult time for families. Schools are back in session while the Delta variant is making more kids sick. Now Pfizer says its vaccine, with just a third of the normal dose, is safe and effective for children 5 to 11 years old. The drugmaker plans to apply for emergency use authorization by the end of the month, but there are several more steps required before the FDA and CDC allow the vaccine into the arms of children across the country. Dr. Wendy Hasson is medical director of the pediatric ICU at Randall Children's Hospital. She's also a parent.
I personally have a child myself that isn't of the age to be vaccinated, so I'm navigating a lot of these issues myself. And so seeing this information be released is just a huge sigh of relief.
Randall Children's Hospital sees the sickest of the sick, and it's treating the effects of the coronavirus.
I've taken care of quite a few children with COVID. I have not admitted to my ICU a single vaccinated patient. Every single patient that I've admitted on a ventilator or on heart support have been unvaccinated patients.
While Dr. Hasson expects the Pfizer vaccine to be approved for use, she is concerned not enough parents will protect their kids with it. Looking at vaccination rates for already eligible adolescents explains the concern. So far in Oregon, just 51% of those 12 to 17 are fully vaccinated. In Washington state, the percentage is 46.6%.
I am concerned that I worry that that number will be even lower in the younger population, because I think in general, people are just more cautious with smaller children. And so I think that the pediatrics community has a long road ahead of them.
Vaccinating our kids for influenza or other things like chickenpox or polio is nothing new. And with a dangerous virus in our midst, doctors like Wendy Hasson wish more people would trust them and follow their lead.
I have been just living and breathing this, right? Because it means everything to me, and I'm a parent. And so I will tell you that, I'm going to look at this data very, very closely, but if this data, it shows that it's safe, which is what I anticipate, I will be the first in line to vaccinate my own child.
Dr. Hasson talks about looking at the data, and there is more of that to come from Pfizer. It is all part of the vetting and approval process, but if all goes well, the vaccine should be available for kids sometime in late October, and then they'll be protected and be able to get a card like this. Tim Gordon, KGW News.